It's using AI in order to predict what's going to happen instead of describing what already happened.
Welcome to a brand new episode of our podcast, Human&AI, Mind, Machines, and the Gradient Descent.
Thanks for tuning into our geeky podcast to discuss the fascinating field of AI and machine learning, corporate craziness, passion for technology, and the role of humans in it. Today, we're super excited to have the wonderful André Hartung with us. André is the president of Diagnostic Imaging at Siemens Healthineers and enjoys to be part of a purpose-driven, passionate, and diverse team from across the globe, which drives the digital transformation of radiology from intelligent imaging, AI-powered clinical decisions to streamlined operations. That already sounds very exciting, so let's dive right into it. André, welcome to the show. We feel very honored to have you with us. How are you and where do we catch you today?
Well, welcome. First of all, thanks for the very kind introduction. I feel honored. Yeah. Today I'm basically in home office. Yeah, as you know, we currently, whenever possible, try to work from home. So, and that's what I got used to now again as well. Basically, I'm sitting here. You mentioned it's snowing in Munich. Yeah, there is very light snow in Erlangen, and I'm looking forward to an exciting conversation with you.
Awesome.
Yeah, we do too. So we found out that you have a background in medicine, right? So what actually brought you from the direct interaction with the patients to the industry at Siemens Healthineers? And what aspirations did you have as a young fellow in Düsseldorf? Was it always the goal to become the president of Diagnostic Imaging at Siemens Healthineers?
Maybe let me start with the last question first. No. That is the simple answer to that. Yeah. Because at that point in time, I didn't even know that a president of Diagnostic Imaging exists. Yeah? So clearly, I had no clue that this is going to be my career path. No, you rightfully said. Yeah, I studied medicine. I worked in neurology and psychiatry for a couple of years in Düsseldorf. In a private neurology facility, and this facility performed as well CT and MR imaging. And as you know, as a fellow, I would say it's not overpaid. Yeah? So every opportunity to do some additional work, and get additional salary out of this was highly welcome. So at the weekend, I did frequently the MR studies for this private neurology center. And that was when I, got fascinated about imaging, and B, get the first time in contact with Siemens. Because as you may not expect, sometimes a machine breaks down, and then a service technician comes and helps you in order to fix it. And over the years, there was a relationship built up between the service technician and I, and we kind of started talking about his job, and I told him a little bit about my profession. And then all of a sudden he mentioned to me, André, do you know that Siemens basically is looking as well for physicians? And they are about to hire more of them. And I said, oh, really? I was not aware. And at that point in time, it was really kind of, I was at a crossroad where I wasn't sure, do I stay longer in neurology and psychiatry, or do I want to try something else? And I got excited by this idea that working in medtech maybe is kind of combining two very interesting worlds. And then I gave and then I wrote an online job application that was in 2001. And I'm not sure. I think it was brand new that you could upload your applications to a tool. 3 months, nothing happened, and then all of a sudden, I got a call from a Siemens employee who asked me for whether I would like to join an interview for a job. I did so, and I said, well, let's give it a try. I can only learn from that. Let me figure out what this is all about. And this was now 20 years ago, so obviously I liked it. I at no point in time, because I said, well, you can give it a try for 3 to 6 months. I can easily return into my old profession. But as mentioned, that was 20 years ago, and I think it was one of the best decisions in my life.
I guess the family makes it hard to leave, right? In terms of the, development and opportunities and the knowledge and the network, and it's some.
Yeah, sometimes as well this situation do change. So that was basically not really the limiting factor at that point in time. Basically I met my wife in Siemens, so sometimes
that's the stats. That shows the stats, right? 60% of all marriages get engaged during the work. So. But let's talk about from lovely things. Let's talk about lovely things, because we love technology. Let's talk about AI, and especially artificial intelligence in medtech, right? So machine learning is somehow it's a vital part of everything what we do currently around, right? In consumer tech, in Livinate, in products, in assistants, and also in medtech, it shapes and transforms many aspects. Can you share a bit from your experience and your view, what is the role of AI in radiology, and maybe what is, the greatest transformation that we'll see arising there through AI?
I mean, first of all, I think you rightfully say it's kind of around everywhere right now. There's hardly anything done without either being touched by digitalization or at the one or the other form of artificial intelligence. You mentioned machine learning as one of multiple ways to do artificial intelligence. And indeed, although artificial intelligence is not new, we are working with that for quite some time already, the performance and the ability by using newer types of algorithms, of course, is fascinating and opens up really new fields, in particular in the field of radiology. And when you think about the challenges of radiology as of today, then on the one hand, imaging, or basically as well all types of diagnostic procedures, are on the rise. And we are basically at the beginning there. And the reason is relatively simple. On the one hand, you have all this mega trends around demography and chronic diseases and so on and so on. So there is a ever-growing demand on that end for a proper diagnosis. This is, in the process, one of the most important steps. Without a proper diagnosis, there is no right treatment later on. So it's basically very closely connected to each other. But you have as well countries that are in development, investing more in healthcare systems, in particular driven as well, not only, but on top by the COVID situation. And therefore, you see more and more people as well in developing countries striving for better access to high quality care. So that drives the demand further up. But at the same time, there is a very severe lack of healthcare professionals. And this is true not only in radiology, but in particular in radiology, where you see that the number of procedures is rising dramatically. The number of healthcare workers is not appropriately being raised at the same time. So what you need to do more with less, basically.
That's a lot of opportunities, and also very important things to go in. And this actually leads us to what Siemens Healthineers is doing. So we're trying to close the gap, right? And there are many awesome applications in the area of AI and machine learning. But what is your favorite AI use case in healthcare at the Healthineers?
I mean, I do like, in particular, those use cases that do show which do show an outstanding customer value. And there is one very recent case that I was really fascinated, not only because of AI was used, but as well because the way we got basically to a solution. When at spring 2020, the issue of COVID-19 become more present and became a global problem. The first thing that we did is we launched an initiative. To build an AI-driven solution in order to diagnose COVID based on CT images. Mm-hmm. And what typically takes easily 1 to 2 years, more 2 years than 1 year, we accomplished in a few months. So we got very close to our customers. We collected in a very short period of time thousands of cases to train the algorithms. We made it available via our research and prototype platforms prior to the official regulatory release as a prototype and research tool. Mm-hmm. As anyhow, most of the institutions did research around COVID. That was basically a perfect fit. So we really could help to diagnose hundreds, thousands of COVID patients in the correct way in terms of what is the stage of their disease, how is the progression moving on. And that was fascinating. It was fascinating because a tool helped to get more insights into a completely new type of disease. And secondly, the way we did it as a team, having everybody on board, working cross business areas, independent of any organizational boundaries, only having in mind how can we be fast and at the same time deliver on the right quality to really make a difference here. So that was certainly one of the most recent and most exciting examples. I could now give you 10 more in terms of AI-supported reading of studies. We have the AI Red Companion and will cover the entire anatomy until 2025 or 85, at least 85% of it. But when you look into what is a very, very exciting future topic, then I believe it's using AI in order to predict what's going to happen instead of describing what already happened. So looking into large data sets, correlate those with each other, try to identify patients, cohorts that are similar to each other in order to prevent certain diseases. Mm-hmm. That can become in the more mid to far term future a real game changer, because then we change healthcare into something what it should be to keep the people healthy. Mm-hmm. And that what we do today basically is we treat people that are already sick. Mm-hmm. And that's from my point of view a very aspirational goal, to use AI in order to really get there and to prevent diseases in the future.
Yeah, I love it. So this somehow relates to, what somehow we see a rising of a digital twin, right, representation. We see it, coming from industry. We're talking to energy, we're talking to buildings, we're talking, a digital twin of everything. And I was, 2 years ago on the radiology conferences, and, you showcased there a bit of the notion of the digital twin, also the patient twin somehow. Can you guys, I guess it's a bit time to go, right? But can you guide us a bit from, from current reality to what we can expect in the future of a digital twin?
Yeah, I think it's a very visionary and at the same time exciting view on artificial intelligence. The being in the situation that we today with our imaging devices can basically digitalize the human phenotype and have it then like a digital footprint or fingerprint that then can be used in order to compare with other cases, makes already or is the first step of creating a digital twin. Yeah. However, there is a lot of more ingredients to it, of course. And when I take one of the examples, which is a twin of the human heart, so a virtual heart model, then it's images, it's ECG files, it's blood tests, it's really very, very many parameters that you need to take into account in order to do something like this. And the aim of such a virtual heart model is to simulate whether a certain treatment in a certain patient is going to be successful, or whether it may be not successful and the treatment plan needs to be modified. So that sounds a little bit science fiction, but it works already today, or is close to work today, in areas where we have the necessary information to do so. And that's at the same time the exciting topic. So creating a digital twin is a most likely never-ending journey, where everything you learn about the human body can basically become part of such a digital twin. And then all of a sudden, you have a twin that you can then as well compare with other twins of other people. And you can look into where are similarities and where are deviations. And if you bring that into the context of a certain disease, then you may be in the driver's seat of understanding, okay, this patient with this images, this side effects, or this accompanying parameters in that situation is so similar to cohort A, B, or C that there is a certain likelihood that he will or she will develop a certain disease. So what can we do about this to prevent the disease developing? And that's of course a little bit the vision far out.
Yeah, that's so impressive. What an important field to work in. Andre, if we zoom in a bit, and we just mentioned that AI is basically everywhere. So in the healthcare process, maybe starting with the patient's very first visit, to the first examination, to the first diagnosis, to the constant monitoring, and even to the treatment in the end, where does AI play a role? Can you maybe guide us a bit through the journey?
Yeah, basically, there you can, on a general note, you can say there is no process step within a clinical pathway that is not potentially subject as well to artificial intelligence. When you take the practical case, for instance, of somebody who is getting a clinical diagnosis or has a certain suspicion to suffer from a certain disease, you see already today a significant change driven by COVID-19. A lot of those appointments are being done with virtual tools. When you get to the scan, basically, ideally, everything is done to make sure that the image quality is going to be really absolute right for the right patient. That starts with artificial intelligence-driven tools like a 3D camera that is registering the patient when he is lying on the table, for instance, from a CT machine. And then it's a 3D registration of the patient. And the positioning of the patient, which is crucial to get good image quality and to keep the dose as low as possible, is being done with an AI-driven algorithm completely automatically. You just push the button, and then the patient is ideally centered. You can as well then use algorithms to make sure that the images being taken are ideally suited to the individual patient's physiological parameters, like the heart rate and so on. You can optimize the contrast media protocol. And then when you look to the other side, there's somebody operating the machine. In the ideal case, it's a highly trained super tech knowing exactly inside out the machine. But knowing that this is as well a precious, very, very difficult to get high qualified people and technicians, it's important that we make our machines extremely easy to operate, instead very complicated. So we have built-in navigation systems that basically guide you through the entire procedure without that. You don't have to know the technical parameters. You just need to know what the clinical question is. And then the system is automatically providing you with guidance, what is the best study, and so and how do you proceed the study.
Hey, that brings us to the point. Maybe also talking about let's say emotional intelligence aspects, because as we move towards more personal medicine, being closer to the patient, to closer to the customer. You also said, right, which is awesome because I guess we can leverage the strengths of algorithms, ability to connect, find patterns, draw insights, and these kinds of aspects. But we need to, on the other side, also combine that with the amazing capability of humans still, right? Rocking reasoning, still super challenging for machine learning system. Empathy, obviously, is something, but also maybe seriously, because we're talking about serious decisions, right? Implications on human level, right? And that means also reflecting maybe on flawed algorithmic conclusions. What is your view? Maybe I don't know the synergies between the emotional, I guess, and the computational intelligence, if we say it like that.
I mean, you said it basically. Yeah, this is not a competitive approach. It's a complementary approach. And this is why we call our AI solutions companions. Yeah, it's really not about replacing a medical expert, not at all. It's basically combining the strengths of both. Yeah, on the one hand, you have an algorithm. The algorithm is never tired. The algorithm does never say, I need a break. The algorithm can work in the background and so on and so on and so on. And on the other hand, you have the human factor who can put the things in the right perspective in a way a machine, most likely for a long period of time, will not be able to do it, who can understand the social context of a patient, who does understand how does the patient feel, who can be empathic, and can make sure that everything that is happening kind of reflects as well how the patient is feeling about it. And at the same time, he can focus on the things that are really challenging in radiology on the diagnosis side. 85% of imaging tests being performed have no significant findings. So 85% of the time of a radiologist is being used basically to report a normal case. Yeah, but at the same time, while the number of procedures is going up, it's basically, you can see that as a waste of time to a certain degree. On the other hand, of course, it's great, yeah, and a relief if there is no negative finding. But they need to have more time to really look into the severe and very complex cases, and then really taking the time to bring the entire patient view on the patient into the game, as I just have described, with all his senses. Yeah, and that, from my point of view, would then be a real win-win situation. That at the end, the overall result is better, more focus to humans, and at the same time, a lot of the basic work is being done automatically, with maybe a quick confirmation still of a radiologist. That will still take a time before that paradigm will change. But we don't see this basically as an added value too much, because we want to make the radiologist stronger, and we want to make sure that he can use his time in the most precious way. And I believe in having this in a companion way, integrated in the workflow of a radiologist, is adding there a lot of value, and is making the difference as compared to just having computers trying to cope with diagnostics.
Nicely put. Very nicely said. Really.
Yeah, it's a very beautiful image of the radiologist together with the companion. But it also raises the question of trust and explainability. So how can the radiologist really be sure if the algorithm is certain or if the algorithm is right. And the algorithms already today shape the decisions of tomorrow, and more decisions are being enabled by data-driven algorithmic services. And so how are you dealing with the black box phenomenon in machine learning? What's the role of explainability in AI in health, and how do we enable that?
Yeah, I think there is an even very valid point. The black box discussion is an ongoing discussion. The
That's a tough
underlying
one. That's a tough one, isn't it?
yes, to some
Yeah.
degree, it is a tough one, yeah, and it's happening not only in healthcare, but I believe it has to be done very thoroughly in healthcare due to the
Yes.
nature of healthcare. It's similar in other areas where AI is being used. Yeah, think about airplanes or cars. But I think before I answer the question, I just want to give one additional layer to it. The black box discussion basically represents the readiness of a society to accept AI to some degree. And that is the real difference. How ready are we as human beings and as a society to accept something that maybe always gets, and healthcare is not the best example because there is no wrong and right so easily in healthcare. Yeah? There are a lot of facets, but there are other areas where there are better examples. But it is, from my point of view, extremely critical that we learn kind of that sometimes things work and they work better than something else, although we may not really fully understand it yet. On top of this, there's another interesting thing. We now have this discussion all over the place. The reality is that in healthcare, most of the algorithms that are being developed are not black box because they are not unsupervised. Basically, the unsupervised approaches are the ones that really result a little bit in this black box phenomenon. The other ones are ones that you can basically explain. So it's not all the same. And yes, I believe there will be an ongoing discussion to what degree really those unsupervised methods can be used in healthcare. And I'm convinced at the end it is about convincing results. Yeah, and only when you will see very convincing results, then I believe there is a certain likelihood that as well things that not always can be easily translated into something that someone easily can understand still gets accepted. Yeah. But I believe it's a time to go before we will get there to a clear answer.
Yeah, but it's somehow tricky, right? And I see a lot of also on the CXO level now the discussion arising on the topics of ethics, to be honest, right? Because it goes hand in hand, and it's somehow a mixture then between who is accountability for that, because making decisions, it's not only business saving but improving lives, right? Which is super nice, but then it's you fuel the discussion about bias of the data, about accountability, maybe sometimes also about the certification. And I get a lot of requests, can AI, or let's say machine learning systems, be certified? Do you have a view on that?
Yeah, good. I mean, this is basically we run pretty intensive regulatory approval processes with AI solutions. So the minimum that you need to prove is that your ability to perform AI based upon test databases. Yeah, so you have one database that you use to train AI, and then you have test databases, and they need to be disconnected, independent from those where you train the algorithm with. And then you need to demonstrate at least that you are non-inferior as compared to a skilled radiologist when he is reading or interpreting the images. So we do clinical studies basically in order to show that in most of the cases we are even outperforming experienced radiologists. And this is not because they are not good in doing it. This is just because it's always working the same way. There is no bias no intrinsic bias. I mean, you can argue about bias, in a different context, but there's no intrinsic bias in an artificial intelligence-driven algorithm. He's doing always with the same accuracy the task. And that is maybe one, and it's extremely fast, because of the computational power. And when you then compare, it's not really a surprise that they are on par and sometimes better than what a radiologist can do. However, taking now the other example of the 15% super complex cases where you have to take all the parameters and the social context of a patient and everything, background, into account to make the right decision, and as well to give today, it's not like black and white, this is what you have to do. Typically, you have options that you put on the table, and the options patients choose from depend on their personal preference. And that there are as well multiple topics influencing this. This, an AI algorithm will never solve, at least from my point of view, not easily in the foreseeable time frame. And this is why when you look into AI in medicine, I believe it can be even supporting that there is basically less bias in the system than the other way around. What is important, though, is that it's trained in an unbiased fashion, which is not easy.
Yeah. Maybe that relates also a bit of the data, right? There's always the discussion, right? The machine learning folks, and we see, a lot of data rising, and we see also a lot of, digital platforms, let's say, social networks, let's say, right? They're using their power of the data is constructed in this platform ecosystem, and they're using that and applying that, right? And then leverage, maybe also extracting some kinds of value, but also maybe also, providing some in the consumer tech or social nature, though it's led to a bit of closed and very concentrated power, right? Consumer tech, social networks, shoppings, and stuff like that, right? Which is a different thing actually in industry, right? About how do we share data? Do we need to rethink, these aspects, open data sharing or openness aspects, a sharing economy? That's super tricky, right? In health, is that? But I thought you leaping a lot of aspects, right? And in the experience I had, with regards to data annotation, the value of data, talking to customers, right? Healthineers were though much of leaping that, to be honest. I thought I found it super stimulating. How do you see that? Is that still challenging for you?
I mean, on the one hand, and that's maybe the good thing for us. We did start collecting data out of very concrete collaboration approaches with thousands of customers already more than a decade ago. This is as well when we started with supercomputers and so on. In particular, in our facility in Princeton to do all type of AI and machine learning experiments and so on. And we have now access to more than 1 billion data sets that we can use. Still, that's not sufficient. And I mean, sharing of data, you mentioned it, do we need to think differently and change paradigms? I believe it's important in medicine to first understand why they are so sensitive about that topic, because it's, of course, information that you would never, patient-related information that you would never like to see in wrong hands. So the matter of patient safety and being compliant with the respective rules is priority number one for everybody who's playing in that field. because if that would be questioned, then the willingness to share data would go immediately down to zero. So that's I think one of the most important first paradigms to understand. Whatever we do and however we share data, it needs to be safe, and basically it needs to be compliant with all respective laws. The second aspect of it is, when you look at healthcare, they have been never champions in sharing data. I believe it's fair to say that, yeah.
Okay.
Because as well of that reason, yeah, that leads partially to now tricky situations, yeah, because basically I would love to see that patients decide whenever they want to decide who can get access to what type of data in an anonymous fashion. And I really believe data around diseases should not become a currency. Because if this is driven only like a business, start to share data, then I believe we do injustice to the topic. And we would leave a lot of opportunities on the table just because the data that would be needed in order to get to new insights is not available. I think that doesn't make a lot of sense. This is why things like, yeah.
No, that's just the first time. That's the first time I hear this notion. Interesting. I love that, actually.
You mean it's at the end? Yeah. The matter is the data is necessary in order to create smart solutions that add value in healthcare. This is basically the decisive step. Yeah, you need to have the data, but then you transfer it into a concrete value. Yeah? And this is maybe a little bit different than in other arenas. Yeah? And on the other hand, there are a lot of governmental initiatives in a lot of countries that are exactly that way, that they put the patient into the driver's seat in order to manage their healthcare data. It's in the Netherlands. Yeah, people by law have to have access to their healthcare data and can make decisions who can get on top access to it and who not. Similar in Germany as well. In Germany, there's an initiative that pushes providers to make sure that patients can get access to their data and as well make a decision on how data can be used. And from my point of view, this is a pretty fair way of doing it. And I would like to see this becoming kind of the standard.
Yeah, that's a very interesting perspective. Thanks for sharing that. And that leads us already to the almost last question. We talked a lot about AI use cases in radiology, about the Healthineers and what you're doing there. But now we want to get to know you a little bit better, and we want to hear an advice from you. What advice would you give genius minds out there who are crazy about ideas and really want to make a difference in the corporate world? Is there something you would have loved to hear when you were a student back in Düsseldorf or an early professional?
Yeah, I mean, it's very interesting that you asked that, or that you put that topic up, yeah, because I believe we feel that there is a change. When I started 20 years ago in Siemens Healthineers, and it was not Siemens Healthineers at that point in time, as you all know, I already feel more freedom basically than I had in my former profession. And the reason is maybe that healthcare at that point in time, when I worked in healthcare, was still dominated by a lot of myths. Yeah, so the things very frequently have been communicate to the patients as black and white. You have that, you need to do that. Yeah. The concept of failure was not really around in healthcare, but it's reality, of course. Yeah, and that's, and when I joined Siemens, basically my experience was I can do what I believe makes sense.
Mm.
Yeah, and I was as well in a fascinating new field. It was around non-invasive cardiac imaging. Yeah, that was at that point in time on the rise. It was like pioneering a new field. It was basically pioneering a new field. Yeah, with a breakthrough where we got to in technology, and nobody stopped me. Nobody did tell me what to do. Nobody gave me too many rules. I believe a lot of this is what you just do. Yeah, I mean, and sometimes I believe as well when I look today in Healthineers, basically you can do a lot. But when you do it, make sure that you understand the value that you really want to deliver. And there needs to be a clear view on the value. And then if it's going complicated or too complicated, fail fast and don't pursue the same way if you see that this way doesn't lead to success. And then I believe management needs to learn to embrace this to the full degree. Yeah, I believe I would not claim we have the perfect failure culture. Yeah, but when somebody like me coming out of medicine, where was zero failure culture, yeah, going into an industry where at least failure was as a conceptual topic around, yeah, there was already a big difference.
Cool.
And the other advice I always give to people is that they should only take advice from people that are as willing by themselves to take advice.
That's a very good one for the end. André, thanks so much for your time. It was so interesting. It's so meaningful in what area you're working. I wish you all the success in the world for your next endeavors. And before we finish, we want to play a game with you. It's called Authentic Autocomplete. It's our final game. And I will give you a couple of sentence starters for the closing, and you will just finish them. Are you ready, André?
Okay, I give it a try. Yeah. Okay.
You give it a try. Okay, let's start with an easy one. So, Siemens Healthineers is?
It is a great place to work.
Nice one. Technology with purpose is?
Technology that is creating value to our customers or the customers of our customers, who are the patients.
And last but not least, the next big thing at Siemens Healthineers will be?
Us pioneering in giving 4 billion people that don't have access today to proper healthcare, in improving this situation and allowing more and more people to have access to good healthcare.
That is a true mission. That's a sustainable thing. That's a helpful thing. So thank you so much, André. I think I could go for hours here, right? Because I think it's really nice to listen to. Yeah, it's nice to listen, and that you share quite reflecting on different aspects and spending this time with us. We highly appreciate. We know you're a busy person, and that's why we really appreciate your time for doing that here. Thanks so much.
I appreciate your time. Thank you very much.
And folks out there, stay tuned. There's a lot more to come. I don't know what, but stay bold, committed, and open-minded. And we hear us at the next Siemens AI Lab podcast. Cheers.
Just a short disclaimer to add. AI Rad Companion consists of several health products and medical devices in their own right and products under development. AI Rad Companion is not commercially available in all countries. Its future availability cannot be guaranteed. As well, to clarify, The AI Rad Companion chest CT does not itself diagnose COVID-19, but rather helps clinicians to diagnose COVID-19.